last few lessons, we have had a look at the Sustainable Development Goals. So kind of just introducing what they are and the kind of the rationale and objectives of these goals. And in the last lesson, we really focused on SDG number 3, which is good health and well-being, as you can see up here. The study design also specifies that you can discuss the relationships between SDG 3 and then some other specific SDGs. So because there's a bit involved in this, we're going to split this across 2 lessons, and today we'll focus on the first few. Just a recap there, the SDGs are 17 global goals, and they aim to end extreme poverty. They aim to address climate change and to fight inequalities and injustice. They're the overall objectives. We've looked at this one. We're going to today focus on these 3. But seeing as you do need to know 7 in total, including SDG 3, we'll just start by introducing what those ones that you need to know are. Just a reminder, SDG 3 is broken into these key features. I'm not going to go through them again today, but I do recommend for this lesson that you have these available somewhere. So either have this slide open, because it's important that you can link to specific features of SDG 3, things like reducing maternal mortality, ending epidemics of infectious diseases, reducing non-communicable diseases, to relate to other SDGs. Okay, so the study design says you need to know SDG 3, which is good health and well-being, as well as 1, 2, 4, 5, 6, and 13. So it might look a little bit confusing, but really you need to know numbers 1 to 6, because that's these ones, plus number 3, and number 13. Okay, just very briefly, SDG number 1 is no poverty. That is the name of that Sustainable Development Goal. SDG 2 is zero hunger. SDG 3, as you know, is good health and well-being. SDG 4 is quality education. SDG 5 is gender equality. SDG 6 is clean water and sanitation. And then SDG 13 is climate action. Okay, so they're the names of the SDGs, as you can see along here. You do need to know, for these 7 SDGs, you need to know their number and the name of that Sustainable Development Goal. So you can come up with your own little mnemonic if you'd like, but one way to remember that is New Zealand's Queen grows cotton candy. To try and remember those in order, just remembering that SDG 3, good health and well-being, is in the middle here. Once you've written those down, I just want you to pop in and answer question 1. So just giving the SDG number and name based on the logo itself. All right, for today's lesson, when we look at the first 3 SDGs, I want you to start looking at the interrelationships. I've included in the worksheet a link to a website, which is a really good little interactive website. When you click on the link, it opens up a wheel that looks like this. And then when you hover or select one of the SDGs, it brings up information from other SDGs that relate to it. So for example, if you click on good health and well-being, it will open up bits like this. So it'll show, okay, good health and well-being is obviously about health, but that relates to SDG number 1, no poverty, by looking at how healthcare costs have an impact on both poverty and on health and well-being. For number 2, it shows the relationship between hunger or malnutrition and good health and well-being. So it might be worth having a quick play around with that first, This then kind of does the opposite. If you press on no poverty, it then relates everything back to poverty. So as we go through, if you're really stuck on coming up with ideas, this might help you to come up with a few. So SDG number 1 is no poverty. Now I just want to note, I cannot imagine the exam asking you to provide lots of information about any of the SDGs apart from number 3. But it is a good idea to understand kind of just briefly what that SDG is about and how it is going to be achieved. So you should be able to write for each of the SDGs probably 1 to 2 sentence description of that SDG. And that's something that you'll do in today's worksheet. So SDG number 1 aims to end poverty in all of its forms by 2030, which is the end of our SDG timeframe, through eradicating extreme poverty. Extreme poverty, remember, is less than $1.90 a day. That's the measure. Reducing by half the number of people living in poverty. So that might be, people living on, say, $3 a day, which is still poverty, but it's not extreme poverty. Implementing social protection systems so people have access to income and money. Ensuring equal rights and access to resources. We know that inequality is a big cause of poverty. And building resilience for vulnerable people, including those exposed to natural disasters. So this is about giving support to people who need it. Okay, so rather than writing all of this down, like I said, I want you to be able to give kind of a 1 to 2 sentence definition for each of these SDGs. So jump into question 2 and come up with that. Okay, where the marks really tend to come from in the SAC and also in the exam is looking at the relationship between the SDGs that we look at and SDG number 3. So linking back to health. Again, I want you to start thinking about this from everything that we've learnt this year. So for the 3 SDGs that we're going to look at today, you've got a little table like this in the worksheet, and you need to provide an example showing the interrelationship between these SDGs. And I do want you to link to a specific feature of SDG 3 if you can. So remember that slide I showed at the start. Link to a specific component of SDG 3. Don't just talk about good health and well-being in general, be specific. So I'm going to give you an example for each one, just because I know it can be a little bit tricky to know what this is asking. So if we look at an interrelationship, we're looking at basically how does SDG 1 impact on SDG 3 and vice versa. So we'll start with how could achieving SDG 3, which is good health and well-being, help to achieve SDG 1, which is no poverty. So you could write that achieving the SDG 3 key feature of promoting mental health and well-being can allow individuals to engage in productive employment, which helps them to earn an income and reduces poverty. Okay, so that's how mental health can reduce poverty. Then looking the opposite way, how could achieving SDG 1, so no poverty, help us to achieve SDG 3, which is good health and well-being? So an example for that, achieving SDG 1 means less people are living in poverty, which can decrease the need for government spending on social security, so things like Centrelink. This money could be used for health promotion activities that encourage healthy behaviours and decrease the rates of non-communicable diseases like obesity. Okay, so linking to a specific feature of SDG 3 rather than SDG 3 as a whole. Okay, so I want you to come up with your own examples, one for each direction of the relationship, I guess, in question 3. Right, SDG 2, zero hunger. Again, I want you to come up with a 1 to 2 sentence description, definition of this SDG. This aims to end all forms of hunger and malnutrition through doubling agriculture productivity and incomes of small-scale food producers. So encouraging or supporting farmers. Ensuring sustainable food production systems. We've talked about how important sustainability is, especially with something like food. Maintaining the genetic diversity of grains, plants, and animals. This really relates to having a wide variety of foods available. We know that we need a wide variety of foods for health. And also addressing trade restrictions that disadvantage farmers. So really, to address hunger, we need to keep farmers farming, we need them to be able to trade, we need the food to be sustainable, we need it to be nutritious. Okay, so just come up with your own little definition of SDG 2. Again, we need to look at the relationship between SDG 2 and SDG 3. So when we look at these relationships, we will always relate back to SDG 3 because that's our main one that we are concerned with. But if you really want to extend yourself, you could be looking at how do SDG 1 and 2 interrelate. But that will not likely come up in your SAC or your exam. So how could achieving good health and well-being help us to achieve zero hunger? One feature of SDG 3 is reducing non-communicable diseases, things like obesity and cancers, through healthy eating. If more people are eating healthy food, such as vegetables and grains, production of these foods will increase, kind of like supply and demand. If people are eating these foods, more of that will be available, and that can contribute to decreasing hunger because you've got more nutritious food available for people. Looking the opposite way, how could achieving SDG 2 help to achieve SDG 3? So how does decreasing hunger increase health and well-being? Well, that should make a fair bit of sense this way. SDG 2 aims to end hunger worldwide through increasing food security by ensuring that families have adequate food, can prevent diseases such as malnutrition in children, which can help achieve the key feature of ending preventable child deaths. Okay, so being really nice and specific to a key feature of SDG 3. Okay, so I just want you to come up with your own example in question 5. Okay, and the last one we're going to look at today is SDG 4, which is quality education. This Sustainable Development Goal aims to ensure inclusive and equitable quality education for all through ensuring free primary and secondary education, access to early childhood development, so things like kindergarten and daycare and those kind of things that help develop skills, ensuring all youth and adults have adequate literacy and numeracy, giving adults access to vocational and tertiary education, so things that will kind of help them to get jobs, and ensuring that new educational facilities are built. Adequate training of teachers. It's a really key thing that to provide quality education, you need to have quality educators. So just write your 1 or 2 sentence definition of quality education in number 6. And finally, we need to look at the relationship between SDG 4, quality education, and good health and well-being. And this is something we have talked about a lot this year, how important education is for health and well-being. So starting with how achieving good health and well-being can help us to achieve quality education, you could say something like one key feature of addressing SDG 3 is reducing child deaths through improving child health. If children are healthy, they are more likely to be able to concentrate on their schooling, which helps them to achieve SDG 4, quality education. The other way around, SDG 4 aims to achieve quality education for all. Through education, people can access health information about the dangers of activities such as smoking, If people don't smoke, they are less likely to develop non-communicable diseases such as lung cancer. Okay, so again, I've been able to link to specific key features of SDG 3. If you're really stuck with how to relate to a key feature, you could talk about the SDG more broadly, but in general, questions will ask you to be quite specific. Okay, so jump in, answer that last one for question 7, and in the next lesson, we'll be looking at gender equality, clean water and sanitation, and climate action.